This is a video to talk about vocal hygiene and how to take care of your voice during sporting events and concerts by Alex, Lauren, and Nicole. Vocal hygiene uses strategies to help preserve vocal fold tissues and the vibration characteristics of the vocal folds. The biggest component to vocal hygiene is avoiding behaviors that can be harmful to the vocal folds. An overall healthy lifestyle consisting of good nutrition, proper hydration, and lots of exercise will contribute to good vocal health. The three main factors that contribute to how much stress the vocal folds will experience are how the voice is used, dehydration, and genetics. Voice disorders occur as a result of phonotrauma or harmful behaviors to the vocal folds. There are four main disorders related to vocal fold use: polyps, which are similar to water blisters; edema, which is similar to swelling; nodules, which are similar to hard calluses; and hemorrhage, which is bleeding due to burst blood vessels. Some signs and symptoms of voice disorders include roughness, breathiness, strained quality, strangled quality, as if talking with your breath held, abnormal pitch, abnormal loudness and volume, abnormal resonance, aphonia, which is loss of voice, phonation breaks, asthenia, which is a weak voice, gurgly, wet-sounding voice, a hoarse or raspy voice, a pulsed voice, which has audible creaks, a shrill voice, which is a high piercing sound, or a tremulous or shaky voice. Phonotrauma are the behaviors that contribute to laryngeal or vocal fold tissue injury, inflammation, or damage. It is the most recently used term to describe harm to the vocal folds and is more widely accepted as it implies a traumatic event, not an intentional action from the client. Vocal abuse and misuse are the previously used terms. They imply purposeful action and can be offensive or insulting to the client. Most of the causes that lead to poor vocal health either dry out the vocal folds or cause swelling from the vocal folds slamming together too hard or too often. Some of the causes include drug use, smoking, chewing tobacco, coughing and throat clearing, alcohol, caffeine, sleep deprivation, talking too much or too loudly, poor nutrition, obesity, dehydration, use of herbals, allergies, or acute sinusitis. In a study from 2016, Hartley, Breeden, and Thibault surveyed 652 undergraduate students at the University of Wisconsin-Madison to document their typical vocal health characteristics, such as voice-related activities, behaviors, and symptomatology. The researchers found that, in general, the students in this study used their voice more during social or extracurricular activities compared to class or at work. The majority of the students, 79% of them, reported talking, and 73% reported laughing, often or all of the time. 50% reported talking loudly, 36% reported shouting, yelling, or cheering, and 27% were singers. When the students attended these activities, they used more vocally demanding activities, for example, yelling, cheering, and singing.
You can experience phonotrauma at sporting events and concerts. You can experience this by yelling, cheering, wooing, or singing. When you yell too loudly, you can experience vocal fatigue, which is soreness or pain in the throat, which is also called dysphonia, and periods of voice loss. When yelling, cheering, and singing, the muscles that control your vocal folds can be also fatigued. In addition, the tissues that make up your vocal folds can be inflamed. Another way is via carbonated beverages. These beverages contain caffeine and alcohol and are not typically high in nutrition. As mentioned, caffeine and alcohol and poor nutrition are factors for poor vocal health. Tailgating before a concert or sporting event is common, and when you are tailgating, you're starting to use these vocally abusive behaviors even before the concert or event starts. The foods that are typically found at sporting events or concerts are high in fat, salt, and lack nutrition. When we eat fatty foods, our stomachs produce more acid to digest the food. When your stomach produces more acid, you can get acid reflux. When the acid touches your larynx, this damages the tissues, which can lead to more inflammation. When you ingest salt, your body reacts by making you feel thirsty. At these events, people typically drink alcoholic beverages or carbonated beverages that can also make you feel more dehydrated. Cigarettes contain toxic and addictive substances that negatively impact the respiratory system and can adversely affect the vocal folds. Smoking and secondhand smoke can damage a person's lungs and dry out the vocal tract. When a person's lung volume is reduced, he or she will have to adduct the vocal folds more to increase the volume of his or her voice. When the vocal tract is dry, this can dry out the vocal folds as well, which can cause the person to cough or clear their throat more often. Alcohol and drug use can also impair thinking, judgment, and reduce inhibitions, which can result in behaviors that are harmful to the vocal folds. When you're sleeping, the body is busy repairing itself and a time for vocal rest. So when you don't get enough sleep, your body may not have been able to heal itself long enough, and optimal voice may not be achieved when a person is tired. At concerts and sporting events, people around you may be using drugs or smoking, and someone may be allergic to that. When you get a runny nose, some of the mucus can drip down onto your vocal folds, which can cause you to cough. And as previously mentioned, excessive coughing can be a vocally abusive behavior. It's important to remember that when you start to feel hoarse, you need to stop talking. This is a way for your body telling you that you're overusing your voice.
Here are some strategies to avoid phonotrauma at such events. First, there are a variety of vocal warm-ups that you can do if you know you're going to be in a situation that will put a lot of strain on your voice. One example involves turning that concert woo into an exercise. Starting from low to high pitch and at a high volume, saying woo and moving the pitch up and back down will help prepare the vocal folds for a period of lots of use. This exercise essentially sounds like you are making siren sounds with your voice. Secondly, using hand clappers or other noisemakers at sports games are a great alternative to screaming and cheering. Many sports venues hand these out for free for people with certain seats or, for example, to distract the other team during certain plays. If they aren't given out, they are almost always for sale in the stadium. Sports games are meant to be loud, however, consider using noisemakers throughout the game, making them do the work instead of your voice. Drinking water before, during, and after the event will help keep your vocal folds hydrated. Hydration is important, if not the key, in keeping your voice healthy. Depending on the event, a voice amplifier might be an appropriate choice. A microphone or megaphone can do all the work for you, making your voice louder without the strain. Do not whisper. Despite what you may think, whispering is actually more detrimental to your vocal folds than speaking normally. Therefore, if you feel like you are starting to lose your voice or it is becoming hoarse, but you still need to speak, try and talk at a normal level of loudness instead of whispering. Vocal rest. Be conscious that you are giving your voice the rest that it needs. If you must strain your voice, keep those periods to a minimum and rest your voice in between. This means using your voice as little as possible. Vocal rest before and after the event can also help prepare and heal your vocal folds. If you live in a dry climate, or especially after such events, a humidifier in your room before or after can help repair damage to the vocal folds. The air may be hazy at concerts or sporting events, and there is often smoke pumped into the air so that the lights are more vibrant. At outdoor concerts or at tailgating, people around may be smoking. All of these contribute to a dry environment, which ultimately is bad for your voice. Lastly, if hoarseness persists for longer than a period of a couple of days, consult your doctor. This video includes a variety of resources if you would like more information about vocal hygiene. These black and white boxes are called QR codes, and if you scan them with a QR reader app on a smartphone, you will be able to access these resources. The first code is for 7 strange but effective ways to keep your voice healthy. The second and third codes link to handouts about vocal hygiene. The fourth code provides tips to keep you talking. Thanks for watching. Keep your voice healthy, and remember, if you're worried, contact your health provider.